Good morning, Mr. James.
Morning.
This is John Keane.
Hi, John.
He's going to be looking after you today. It's I see everything looks ready for your care today. I'm sure John will make you comfortable.
Fine.
John, I have to go and see a student down in one of the other rooms. Mm-hmm. I'll be back a little bit later.
Right.
If you need me for anything, just page.
Okay, sure.
Okay?
Yes. Hello, Mr. James.
G'day, John.
Let me just check your chart before we begin. I see you've got hepatitis B. We've just had some lectures on that. It's interesting that the symptoms are similar to AIDS.
Great.
Of course, the spread is different. You can't catch Hep B the same way that you catch AIDS. That's comforting, isn't it?
Yes.
Now, I have to make sure you understand the precautions we're taking, so while I make your bed, we'll have a talk about it.
Okay.
Let me just help you into this chair. Because hepatitis B is spread by a virus, it's very important to stop the spread to other patients.
Yeah.
That's why you're in this room by yourself. Mm-hmm. In fact, all your cutlery and crockery and anything else that you might use should be in here too. And I don't think this book should be in here.
Right. Are you feeling okay out of bed, Mr. James?
I was just telling Mr. James about the precautions we have to take because of his infections. How he has to be careful with his cutlery and going to the bathroom. And of course, most importantly, washing his hands after using the bedpan in the toilet.
I see. I was asking you how you were feeling, Mr. James.
Yeah. Well, before all of this, I've been pretty active. I'm finding this fatigue and lying around in bed really wearing. I've been hit with a couple of really bad bouts of nausea, especially in the morning, and that's making me feel really crook. And, well, this hepatitis bit, there's some problems there that I've been sort of stewing about. So I don't know.
John has explained to you why we isolate you like this, hasn't he?
Oh, yeah, I don't
Yes, well,
remember.
remember, Mr. James, I've told you, the first principle is hygiene. There are many different schools of thought about the spread of infection, and in this hospital we make sure that every possible precaution is taken. We wouldn't like to risk you in any way. You must stay in isolation, and at all times, personal hygiene is very important.
You seem to be feeling a little bit uncomfortable about this at the moment, Mr. James. John and I might go and have a little talk while you have a rest. We'll come back in a little while. You have a think about anything you might need to know, anything that might make you feel better, might make you feel a bit more comfortable.
Fine, okay.